Thank you, Sudhapat ma'am, for that kind introduction. At the outset, I would like to thank IMA Kasaragod for giving me this platform to present on cosmetic dermatology. So I am here to give you a brief overview of what cosmetic dermatology is. So cosmetic dermatology is synonymous with aesthetic dermatology, and this includes various treatment procedures that are meant to enhance a person's appearance by reducing or eliminating the imperfections. Like Sudhapat madam has rightly pointed out, it definitely improves a person's self-confidence and quality of life in this age of social media. So this is a brief outline of what I'll be talking about. I'll be briefly touching upon different laser devices that we use in cosmetic dermatology, different injectables, thread lips, and some high-energy devices like HIFU and radiofrequency devices, and a brief note on chemical peels and PR. Laser, as you all know, is the amplified light that is produced by stimulated emission of radiation. So, when laser is not just used in the specialty of dermatology, but across all other different specialties in medicine. So, we choose a laser so that we target a specific form. For this, we have to select a laser's wavelength, its pulse duration, and energy parameters, so that we can selectively damage our target chromophore by minimal collateral damage. The most commonly performed laser procedure in most cosmetic clinics today is laser hair reduction. So here our target for the laser is melanin, which is present in the hair shaft and the matrix. So for this, we have to use a wavelength of laser that targets the melanin in hair shaft and has a pulse width in the range of few microseconds. Now with laser, we aim at destruction of this hair follicle and also miniaturization of hair follicle. With multiple sittings, we are able to give them long-term stable reduction in the number of hairs that is regrowing. For hair removal, we use lasers. Commonly used lasers are the long pulse Nd:YAG with a wavelength of 1064. It has a long wavelength, so wavelength is directly proportional to the depth of penetration. So with long pulse Nd:YAG, we are able to target the hair bulb. Then another popular laser for hair removal is the diode laser with a wavelength of 810 nanometers. There are various other lasers with shorter wavelength like AKP laser and ruby laser, but these lasers are highly used in Indian skin because of fear of post-inflammatory hyperpigmentation. With the advancement of technology, now we also have different newer lasers like triple wavelength laser and quadruple wavelength laser, where we combine multiple lasers wavelength in a single machine and handpiece. So you may ask why a combination of triple or quadruple wavelength laser. That's because the hair follicle is not arranged in a linear line in the dermis. They are arranged in different planes. So with the use of a quadruple wavelength or a triple wavelength laser, we are able to target the hair follicles arranged at different levels. So giving better, improved results. Now for the indications for hair removal, we can always remove unwanted normal hair with laser hair reduction. And then there is hirsutism, which is abnormal or male pattern terminal hair in females. Most commonly seen with PCOD. Of course, we have to combine it with our medical management. And then hairy nevus. Some nevuses can have hair over it, so it can look unsightly. So we can also remove the hair on the nevus with this technology. Then hair bearing skin graft. Like in this picture, you can see that girl has a skin graft from a hair bearing site on her face. So it doesn't look normal. So we can remove the hair on that graft with this laser hair removal. Then many pathology diseases which has the pathology revolving around the hair and hair follicle, like pseudofolliculitis, pyrorhinositis, and also hidradenitis suppurativa can be treated with this technology. The adverse effects are minimal with the new type of machines. There can be transient pain, which is usually tolerated, and in some patients we can also use topical anesthetic prior to the procedure. They are apprehended. There can be transient erythema and hyperpigmentation in some patients. Next, we talk about laser for pigmentation. So pigmentation, we are targeting the chromophore melanin. It can be situated in the epidermis, dermis, or both. So here what we need is a laser that can target the melanin and also has a pulse width, a very short pulse width, that is in the range of nanoseconds. So we deliver lasers with high energy and short pulses. So we have to quality switch the laser to achieve this result. That is called Q-switch lasers. So the lasers used for pigmentation are Q-switch NdF, Q-switch ruby, and Q-switch alexandrite laser. The various indications for pigment removal are in the epidermal deposition of melanin, you can see capillary macules, lentigenes, freckles, and for dermal deposition of melanin, we give you a bluish gray pigmentation, like you see in nevus of Ota, blue nevus, Hori's nevus, and in some cases there can be deposition both dermis and epidermis, like in post-inflammatory hyperpigmentation, melasma, periorbital, and periocular pigmentation. So now you can see a patient with freckles. Here is epidermal pigmentation, which can be treated with 532 wavelength Q-switch NdF, and then there is a patient with a blue-gray pigmentation over his cheeks, that is the nevus of Ota, which can be managed with Q-switch NdF with a longer wavelength of 1064. So you have to reach the epidermis. And melasma can also be treated with lasers, but that is not the sole of the first modality of treatment. And with Q-switch NdF, you can also remove the tattoos, like amateur tattoo, professional tattoos can be removed. Professional tattoos can be a little tricky because you use multiple colors. So we'll have to combine different lasers of different wavelengths to target the different colors. Then in traumatic tattoos, that is tattoos because of the pigmentation that gets impregnated in the skin post-road traffic accident, can be easily treated with Q-switch NdF. One another application for Q-switch NdF laser is carbon facial, which is currently trending in social media. Here we use carbon particles applied in a paste form on top of the skin. So this carbon particle sits on the stratum corneum and is also on the pores. Now we give a single pass of Q-switch NdF laser. Here the carbon particles act as a chromophore. So all the energy from the laser is absorbed by the carbon particles, causing microtoma to the cornea, stratum corneum, and the pores, causing tightening of pores and decreased sebum production. So this can be done in patients with oily skin, acne-prone skin, to give you a refreshed appearance. Next, we'll talk about the resurfacing lasers. To resurface means to change the skin's texture. If there is any textural abnormality, you have small scars, depressed scars, which can be improved with this resurfacing lasers. There are different types of resurfacing lasers. So first there was this ablative resurfacing laser. Most commonly available is the carbon dioxide laser. So what this laser does is actually removes the layers of epidermis and allow regeneration of epidermis, giving improved texture along with collagen remodeling in the epidermis. But the problem with this is that when you do ablative resurfacing of the whole face, there is always risk of post-inflammatory hyperpigmentation, especially in Indian skin. So it is not usually done for resurfacing. Then came the fractional ablative resurfacing, where the same laser was fractionated. The laser light that's coming is not a complete beam. Small micro beams are used in fractional ablative resurfacing. So there is only microtoma that is happening to the epidermis and dermis. So there is better healing, decreased downtime, and decreased chance of post-inflammatory hyperpigmentation. And there is also non-ablative skin surfacing, where there is no epidermal damage. Only the dermis is targeted with this type of laser that causes collagen remodeling and tightening of the dermis. So fractional lasers can be used for facial rejuvenation, acne scars, depressed scars, and keloids. Ablative lasers can also be used for facial regeneration, but not usually done. You can use ablative laser to remove any epidermal lesion, like seborrheic keratosis in melanocytic nevus or verruca sitting on the skin. Next is the energy-based device, which uses radio frequency, called the microneedle radio frequency, or MNRF. Here a probe containing multiple microneedles are stamped onto the skin, and this needle is used to deliver radio frequency current into the dermis. Here the upper part of the needle is actually insulated to protect the epidermis. The radio frequency current is only delivered into the dermis. So this radio frequency energy causes microtrauma to the dermal collagen and helps in neocollagen synthesis and tightening of skin. So this is very useful in treating acne scars, open pores, depressed scars, stretch marks, and mild skin laxity can also be improved with this kind of laser. This is a patient treated with MNR. You can see there is a drastic improvement in the texture. Now, the million-dollar question: how to counter aging? Is it actually possible to stop aging? Unfortunately, no, but we can always decrease how much that age shows on your face. So with aging, what happens is that there is body resorption, loss of fat volume. There is also redistribution of the fat that gives you a more tired look. That cheek pad loses its fat volume. So you develop wrinkles and tired look. So this can be countered with different cosmetic procedures. Now next I'll be talking about few of them. Dermal fillers. Dermal fillers are soft tissue augmentation by replacing the lost volume. The most commonly used dermal filler are the hyaluronic acid. Hyaluronic acid, you know, it is a viscous substance that is injected subdermally into the skin to give you that lift. So we can also use autologous fat, that is fat harvested from the patient himself or herself, that can be modified and injected, that can give you a longer lasting result. Hyaluronic acid can last, it's not permanent, it's temporary. It can last anywhere between 8 months to 1 year. The patient will need repeat injections and touch-ups. So with dermal filler, you can actually treat the hollowing of the temple. You can do a non-surgical rhinoplasty, or you can improve the contour of the nose by just injecting hyaluronic acid. And then you can correct the teardrops, that is the hollowing under your eyes, that can give you a tired look. That can be corrected by injecting hyaluronic acid. You can give a cheek lift to give you a younger, plumper look. And the nasolabial fold can be obliterated. Lip augmentation can also be done. Then the jawline chiseling can also be done with hyaluronic acid fillers. So now this is a patient treated with hyaluronic acid filler. You can see that there is a cheek lift and obliteration of nasolabial fold. Adverse effect. So this is an injectable technique. There is always a risk of bruising and pain, which is self-limiting, and then hematoma. Then the procedure has to be done under aseptic precautions. If not, there can be always a risk of infections. And most dreaded complication is the vascular occlusion. Any arterial injection of the same product can cause vascular occlusion. Next, I will be talking about botulinum toxin. It is derived from Clostridium botulinum, and what it actually does, it prevents the release of acetylcholine into the synapse, the neuromuscular synapse. So there is no muscle contraction with the use of botulinum toxin. So how can we use botulinum toxin as an anti-aging substance? So we know that most of the muscles of facial expression are originated in the facial skeleton and enter into the skin or the superficial aponeurosis. So as we move our face, you can see the wrinkles develop. As we age, the wrinkles become more prominent. So by choosing the muscles that is giving you more wrinkles and injecting in botulinum toxin into the belly of this muscle, can improve that wrinkles. So we can inject botulinum toxin to the frontalis to correct the frown lines. For crow's feet, you can use botulinum toxin into the orbicularis oculi. And you can also correct the necklines by injecting botulinum toxin into platysma. Adverse effects, again, this is an injection, so there is always risk of ecchymosis, pain, and edema. Inadvertent injection into the periosteum bone can result in headache, which is again transient. We have to be very careful by injecting Botox because a high increased amount of injection and choosing the wrong muscle can always cause a frozen mask-like facial that gives you no expression. So that expression should always be maintained, and we should be careful by injecting Botox. Then inadvertent injection into the wrong muscles can also give you unwanted effects like brotosis or drooping of the angle of mouth. Then again, the Botox is also short-lived. It can last anywhere between 6 months to 1 year. So this is a patient treated with Botox in his frontalis for the forehead wrinkles. So this is what Botox can do. Next is thread lift, where we use polydioxone threads into the subcutaneous layer, And these threads are absorbable threads. So what this threads does is it stimulates neocollagen formation and give you a lifted appearance. So where and how the threads are inserted gives you the desired lift. So it can be inserted to give you a jawline lift, nasolabial line lift, can improve your jaw or marionette line, and also give you eyebrow lift. It can also be used for improving the acne scars or textural skin. These kind of threads are actually called sugar threads because they dissolve very fast. And then next are few energy-based devices that we use in cosmetology. The first is the radio frequency skin tightening. Here, what we do is that we use radio frequency energy that is causing micro trauma to the dermis. So that can cause inflammation and neocollagen synthesis, neoelastogenesis that will result in wrinkle reduction and tissue tightening. So by using hyaluronic acid, we actually fill up the lost volume, but with radio frequency tightening, we tighten the skin so that it will give you that snatched look. It can be used especially in people who have lost drastic weight and has redundant skin. They need tightening of skin. Only minimal laxity, mild to moderate laxity can be treated. If it is excessive, then they will have to undergo surgical facelift. It can also be used for localized heating of adipose tissue that can give you a body contour. So this is a patient treated with radio frequency, then it can be a minimal skin tightening with this use of this technology. This is also another technology, ma'am has already spoken about it. It's the high intensity focused ultrasound or HIFU. So it does the same thing, but it's a different technology. Here the ultrasound waves are used. The advantage is that it penetrates deeper and can be used for more bulkier face. Here again you can use it for facial rejuvenation, lifting, tightening and body contouring. So you can see that the double chin has drastically improved the use of HIFU. So non-surgical fat reduction can also be done with HIFU. If you have a selective fat pocket that has to be lysed, we can also use injection lipolysis with chemicals like deoxycholine and phosphatidylcholine, which are injected into the submental or double chin fat, which lyses that fat. Now, what about chemical peels? Chemical peels are commonly performed cosmetic procedures. Here we apply a layer of chemical onto the skin to give a controlled destruction of skin and exfoliate the upper layer of skin and regenerate new tissue. It is done for different conditions like melasma, acne, photo-aging, fine wrinkles, dilated pores, and facial rejuvenation. There are different peeling agents that are available in the market today, like glycolic acid, salicylic acid, lactic acid, trichloroacetic acid, ferulic acid, retinoic acid, and even combination of these agents. PRP or platelet-rich plasma, it is power-packed with growth factors and rich in platelets. This platelet on injecting gets activated and release these growth factors. These growth factors help to modulate tissue repair and regeneration. PRP is actually made from the patient's own blood. So we draw blood from the patient and first give a low spin. So all the RBCs are collected down. Now we withdraw the plasma and the buffy port which has the platelet and give a high spin. And with the high spin we are able to concentrate the platelets and we discard the supernatant and inject the PRP. The indications of PRP are many. For patient rejuvenation, we can use PRP as vampire facial, where we combine it with microneedling. Then there is also androgenic alopecia, that is the most commonly performed indication, and there is alopecia areata, scar revision, stretch marks, not healing ulcers. Because of the presence of growth factors, they help in wound healing. Now, a word of caution before I wind up my talk. Informed consent before any cosmetic procedure is important, and we must always ensure that we take a pre and post procedure photograph, because patient might be more conscious after a procedure and they might point out different problems that they already had before the procedure, after procedure. And we also have to be beware of patients with body dysmorphic disorders and unrealistic expectations, because we will not be able to deliver to such patients. And you have to always under-promise and over-deliver. Thank you.